And it could be distributed as soon yet as next week.
And Valleywise Hospital says their ICU is completely full. They're still accepting patients who need critical care, though. Across the state, ICUs, the state is reporting, is at 91% capacity.
And right now, we want to bring in Dr. Ross Goldberg, the president of the Arizona Medical Association. Dr. Goldberg is also a general surgery specialist. He's affiliated with Valleywise Health Medical Center.
Doctor, how are you tonight?
Good evening. How are you?
I'm doing good. For the layperson who hears this, the ICU is full. Outside of COVID cases, is there a warning for anyone who comes in with any type of critical care needs tonight?
Well, let's also be really clear exactly what we mean by the ICU is physically full, meaning those certain beds are full with patients, not just COVID patients. But we are providing ICU level and high quality care in other areas of the hospital.
Okay.
We're kind of expanding our ability to do ICU coverage. So it's not that we're closed to ICU.
Okay.
It's that we are doing it in other areas you don't normally see, but we have the capability and ability to provide that high quality level of care, and we're continuing to do so.
Yeah, we needed that clarification because that sounds scary, even though it is pretty scary right now, the level of the amount of people that you have in the hospitals right now.
It's not ideal. We have been talking about this for a while, the concern of a surge. What makes this different than what happened in July is that in July, it was a COVID-only surge, if you will. Now, November, December are a busy time of year for us. Flu, other medical issues, this kind of all normally happens to us when we're busy. Now you've added COVID surges on top of it. We had one, then now we're kind of seeing the Thanksgiving surge, and we're worried about further surges with the holidays. So that's why we're trying to really get the word out to have everyone please do their part so we don't really push the brink of our resources.
And Doctor, we're going to get to some of the vaccine news coming up in just a moment, but I first want to ask you, because Yetta just mentioned, right, I mean, we are breaking records left and right with so many people so sick that they're in the hospital right now. This virus has been around for about a year now. Have doctors kind of figured out a better way to keep those patients alive? Because, you know, I've heard some doctors flipping patients over on their stomachs to help them breathe better. If somebody does come into the hospital right now this week, they're severely sick, do they have a better chance at survival than at the beginning of this pandemic?
Well, I think we've learned a lot since when we talked about it in March and April. You talked about the proning technique, different medications, how aggressive we are not using our ventilators. We've changed our approaches as we've learned. That's what happens with science and medicine. As we accumulate more information, we're able to alter our treatment plans. Funny enough, now, the majority of patients are not, we're overwhelming our ICUs because of COVID patients. We probably had more ICU patients that were COVID the last time. We just have a lot of ICU patients right now, and COVID is adding on top of that. So we have gotten better with our techniques. There's newer medications out there. So we are evolving, and we'll probably evolve further even as the vaccine's brought out. We're going to still develop new treatments. Look at any treatment plan throughout history. We always change, evolve to make it better. So we're still doing that, and we will continue to do that.
Yeah, that is good news. So let's talk about the vaccines. The COVID vaccines are underway now. It's going to be a while before most of us, you and I, well, not you, but me and Brandon and everybody else, get the vaccine. So when do you think the number of vaccinations will actually start to curb the number of cases coming into hospitals and the number of people getting sick?
Well, that's going to be an interesting point. You've heard a variety of different conversations on that, depending on how many doses we get out to the public. So I've heard summer is going to probably be the time where we're all estimating where things will be back to what I call normal. Right up till then, we're all going to have to be wearing masks, doing the physical distancing. Even someone like myself who will be getting the vaccine probably pretty soon, I still have to do those masking and the techniques because we don't know, A, if I can transmit it still, and we still haven't gotten that level of immunity throughout the population. So everyone's going to still have to do this for a while, but the idea is that there is an end to the, there's a light at the end of the tunnel, if you will, that we know maybe sometime near the second half of next year that we have some hope that we all can kind of be caught up to it by then.
And Doctor, I'm wondering if you've heard of this group. They're called America's Frontline Doctors because they're getting a lot of traction right now on social media, and I'd like to ask you about it. 7 doctors, they protested outside of the CDC yesterday. Their message to Americans were this. They're protesting against forcing millions of Americans to take what they are calling an experimental vaccine, a pathogen with a survival rate, they say, of 99.7%. They're getting a lot of attention for it, and I'm wondering your reaction to seeing 7 doctors outside of the CDC telling Americans not to take the vaccine.
Well, everyone has the right to say what they feel and they think. I would never go against anyone's right to do that. But I will tell you the science doesn't agree with them. First of all, the mortality rate is higher than the 0.03% you just talked about. And it's always a concern. I would never force anyone to do anything. We don't want to talk about that. What I want to do is to demonstrate and show that things are okay and safe. I reviewed the FDA executive summary. I looked at the data that Pfizer released. I was on a call listening to them talk about this vaccine. This technology is not new. We are utilizing it a new way. mRNA is not a new thing to us. We finally have the ability and technology capable of doing it. It's actually exciting times with these breakthrough in technology of what we can accomplish. But I put my money where my mouth is. I will be getting the vaccine. And one thing I've been telling people is that what I will do every day after getting the vaccine, I will go on Twitter, post a little video, an update of how I am doing. I will do that through the second dose to show that it's okay to get.
And thank you for doing that when you do get the vaccine. Let's talk specifics about it, though. Let's say when I can get the vaccine. Obviously, as you said, I still wear a mask. I still socially distance myself. But what is the status for me right after I get that vaccination as far as contracting the virus and getting sick?
Well, you have to give your immune system a chance to react. It's not like you get it instantaneously and you're protected. And remember, 95% efficacy is a great number, but that's still 5% chance. So there's still a balance here. So you still need to be safe. So getting it, you start your immune system going. And in particular case, the Pfizer vaccine and the Moderna one coming out, hopefully next week if everything goes okay, is that you get the second shot as a booster. So the first shot's like a priming of your immune system, and the second kind of sets it really high up so you're good to go. Now, the numbers from the Pfizer data are interesting, where there's that 88% efficacy after the first dose, but we don't know if that lasts because everyone got the second dose. So that's why you're still going to get the 2 shots for that vaccine.
And does that mean that I cannot contract it? What does that mean exactly?
So what they've shown from the studies is that nobody who got the vaccine got severely ill from COVID. Doesn't mean you can't get it. And the other question we don't know is, can you still give it to other people? What you've done is prime your immune system to fight it off, but doesn't mean you can't still be a carrier. So you can technically be infected by it. It could be kind of in your nose, in your nasal pharynx, but you don't know if you're giving it to anyone, and it's kind of inert sitting there because you've already protected yourself from it. Okay. It's the idea of, can you give it to other people and can it still spread around? That's why we're trying to get to that herd immunity by in the summertime, where the virus out there doesn't really matter, kind of like we do with other viruses that we deal with.
Like the flu. Wow. Dr. Ross Goldberg, oh my goodness, thank you so much for being here. You make everything so easy to understand. We appreciate you.
Right. Thank you so much.
Be safe. We'll be right back.